Yep.
All right. Welcome everybody to this session on assessing and addressing scapular dysfunction. Now, my name is Adam Youngsma and I'm coming to you today all the way from Toronto, Canada. And I'm really excited to be able to share some really great knowledge with you surrounding an area that is often injured and painful in most clients.
欢迎各位同学来参加今天的课程。那今天一节课我们会来聊一聊肩胛骨功能障碍的评估以及解决。那我是 Adam， 来自加拿大的多伦多非常希望能够今天通过这样一个远程课堂的形式，帮大家去了解一个经常受伤的这个关节。
I would like it just to take a second to thank all of you for attending and also everybody who's been involved in putting this conference on. So everybody at Idea China, I just want to thank all of you for everything that you've done to make this possible.
所以开始之前，想感谢各位同学来参加我们的大会，也感谢大会的会务组为了大家搭建了这样一个学习的平台，所以我们非常感激有这样的一个机会。
Having worked in a lot of rehabilitation clinics, from chiropractic offices to high-level strength and conditioning areas, I've had the opportunity to work with many clients who have had varying degrees of shoulder pain, from something that's more acute, so just sudden onset, to something that's more chronic and long-lasting.
我过往的经历呢，会从诊所这个康复的诊所，一直到顶尖的运动员的体能训练都有参与。所以在这么多年的经验中，会碰到很多人会有肩部的疼痛，有一些呢会是急性突发性的疼痛，也有一些会是慢性长期伴随的疼痛。
Now, through all of that time seeing clients with shoulder pain, what's been interesting is seeing recurring patterns in the shoulder pain in most clients. Now, I'm not saying that they're all the same, but what I'm saying is that often the dysfunction causing the pain is very similar. And so therefore the rehabilitation is very similar as well.
所以在看到了这么多真实的损伤案例之后，会发现一个很有意思的现象，就是大家的这个伤痛机制可能不是完全相同，但有很高的相似性。所以关于肩关节、肩胛的康复呢，在训练的手段上也会有比较强的这个相似性。
So within this session, what we're going to plan to do is walk through really what is scapular dysfunction. So how are we going to define first dysfunction, and then what is it about the shoulder and the scapula that lead to so much pain in that upper body, in the shoulder area? And then we'll talk about, okay, how do I assess this dysfunction? So what am I actually looking for? And then how do I address it using a particular path, a particular process in order to get them from that pain back into high-level performance again?
所以今天我们会来聊一聊，首先什么是肩胛功能的一个受限或者功能的障碍？那为什么肩胛骨跟我们的肩关节经常给上肢带来很多不想看到的这个疼痛问题？以及如何去通过评估一步一步的排查找到问题，并且去进行解决。
The other thing that I really want to point out is when a lot of clients come into a rehabilitation clinic for something like shoulder pain, it's quite interesting. Oftentimes it's been nagging them for a long time, meaning that it's been around and recurring for probably 6 weeks or so before they actually come in and think that there might be something wrong. So they let it go for a fairly long time. But also they've tried other things on their own in order to try to fix it before coming and seeing somebody about it.
那还有一个非常有意思的现象，就是通常这些来到诊所说自己肩痛的客户呢，都会有一段时间的这个已经存在了疼痛，比如说通常会在6周以上，疼了很久才会去看医生、看诊所。那还有一个问题就是他们会自己尝试一些方法，先去解决可能搞不定之后呢，再去来到诊所去找物理治疗师。
Now, oftentimes when you go to a rehabilitation clinic, the physiotherapists, the chiropractors are really good at making things asymptomatic, so taking away your pain. But this is often because they focus their efforts on the actual site of pain, so in this case, the shoulder, and they don't look at all the other areas affecting that shoulder and its movement and the centration of the joint. And so we're going to look at the shoulder more from a proximal to distal viewpoint, really focusing on the thoracic spine, the scapula, and then looking at the shoulder itself.
好，那实际上在诊所的这些物理治疗师或正骨师在处理你的疼痛的时候，其实他们会非常擅长的就是快速解决你的疼痛啊，因为他们每天都在做这个事情，但往往会忽略一个点，就是他们更多关注在造成疼痛的单一肌肉或者单一问题上，没有从整体去观察到底是什么原因造成了这个疼痛。所以今天我们可能会从这个具体的这个很细节的位置稍微拉远一点，让大家更看到整体。我们会从脊柱、从肩胛的位置，再到肩关节，一起来分析一下是什么造成了这些损伤、这些疼痛。
It's also finally important to note before we head in that when you think about shoulder pain, now we're going to be talking about the mechanics and movement dysfunction relating to shoulder pain and scapular dysfunction. But it is important to note that shoulder pain can also be coming from nerve impingement in and around the shoulder. And so I just wanted to point that out, that not all shoulder pain is actually a shoulder problem.
好，那还有一个需要大家在开始之前先明确的就是，我们很多肩部的这个疼痛啊，有可能是肩胛的问题，或者是肩关节出现了撞击，或者是卡牙神经。它不一定完全都只是单纯肩关节的这个问题，所以我们需要有个意识，就是肩痛不一定只看肩，还需要看其他部位。
So let's just ask ourselves this question. If you have a client or an individual in the general population who comes in to see you or goes in to see a rehabilitation specialist, what have they tried before? So like, what are most people doing when they have shoulder pain?
所以我们先来假想一个场景啊，就是当你的客户或者一个人走到这个诊所，想要去治疗他的肩痛的时候，那通常他们都是什么原因，或者是在做什么动作的时候会痛？
Now, most often, and they may not admit this to you, but most often they are searching on YouTube, they're searching on Instagram, they're searching on the internet to try to not only self-diagnose their pain, but also probably for the best mobilizations to do.
所以很可能啊，这些人呢，不光在这个网站上搜索如何解决疼痛，他还会搜索一些如何去提高肩部的灵活性等等的操作，自行去完成。
And this often results in them hooking up a band and yanking on their arm and shoulder in really weird positions and thinking often, because if you look at a lot of the information that's available on the internet, thinking that it is a shoulder mobility issue, but that's often not the case.
所以很多人可能会模仿网上的动作，拿个弹力带套在肩关节，然后主动做一些旋转的动作，看起来很奇怪的动作。他们可能觉得他的疼痛来自于肩关节的灵活性不够，但实际上很多时候并不是灵活性的问题造成的疼痛。
And there's often negative side effects to these mobilizations where they're actually pulling the shoulder, specifically the glenohumeral joint, into a really poor position. And trying to add mobility to a dysfunctional joint can lead to increased amount of damage in the joint, as well as increased levels of pain later on.
所以当他们这样做的时候，这个灵活性训练会适得其反，因为他们会对整个肩关节，尤其是我们的盂肱关节进行进一步的牵拉。那这个牵拉可能是在一个本身功能就受限的关节上，造成了更大的拉扯、更大的压力，以及更多的这个关节内部的损伤。所以这时候可能造成未来疼痛的加剧。
So we have to understand that with dysfunction, oftentimes it's actually addition by subtraction. So not adding more mobility, adding more mobility isn't necessarily what we need. Oftentimes it's actually removing some movements that are causing the pain and adding some stability to the adjacent joints can help us to improve dysfunction and shoulder pain.
其实另外一个很常见的，或者是发生概率很高的，实际上是这个关节它的受限呢，可能是有足够的稳定性。我们可能需要去把一些造成疼痛的动作拿掉，然后多练习一些关节的稳定性，这个时候可以让它变得更加的健康。
So let's just take a moment here to define actually what dysfunction is, because I've mentioned it a lot in our conversation and it's part of the title of this presentation or this session. And so let's talk a little bit about what dysfunction actually is. So the definition, if you look, search through the research and through the dictionary, is it's abnormality or impairment in the function of a specified bodily organ or system.
好，首先我们来理解一下什么叫做功能障碍或者是功能异常。那它这边如果你查字典的话，它严格的定义呢是指身体某一特定的器官或者一个位置，它的功能出现了异常或受损。
And so dysfunction should come to you as saying, okay, there's something wrong with regards to the actual function. And so the title of, as I said, this session is assessing and addressing scapular dysfunction. So we're going to really hone in, we're going to really focus on the role of the scapula in shoulder pain and shoulder injuries, so that we can better understand how the system works together in order to optimize upper limb movements.
所以顾名思义啊，我们的功能受限、功能障碍指的就是身体有某一项正常的功能出了一些问题。那今天我们的课程主题呢，会是肩胛功能的一个评估以及解决，这意味着我们会花很多的时间关注在肩胛骨它正常的功能应该是怎样，那它的功能为什么会影响到肩关节的运动，影响到整个上肢训练，影响到造成一些疼痛的这个问题。
So let's take a quick look at a little bit of a functional anatomy of the actual shoulder itself. So now when we talk about the shoulder or the shoulder complex, oftentimes we talk just about the glenohumeral joint, so the humeral head and the glenoid of the scapula. But it's really got a very, very complex structure and function.
好，所以通常啊，我们会提到肩关节，就会想到就是这个简单的盂肱关节。那实际上肩复合体会是一个更加复杂的结构。那我们目前只关注的就是这个肱骨头跟这个肩胛骨的这个窝连接在一起的这个关节，盂肱关节。
Now, there are several bones and joints involved in the actual function of the shoulder, and they include everything from the clavicle itself. So the clavicle is the collarbone. It includes the glenohumeral joint, so the humeral head and the scapula. It often involves a lot of thoracic spine and rib cage movement, and then the scapula itself. And so there's a lot of moving parts in and around the shoulder that are required to be coordinated to allow for optimal movement and function of that shoulder.
但实际上，如果你想让你的肩达到最理想的运动状态啊，它这边还有很多其他的结构，比如说我们的锁骨啊，会与我们肩形成肩锁关节，然后我们的这个比较熟悉的就是我们的肱骨会跟肩胛骨形成一个盂肱关节，那再加上整个胸椎以及胸廓的运动，还有肩胛骨的运动。所以以上这些组织共同的协调，完成了一个肩的整体的运动。
Now, this complex structure actually leads to the greatest potential range of motion of any joint in the body. And it's good in that there's a lot of range of motion, so you can do a lot of things with that upper limb, with that shoulder. But it also leads to a increased or higher incidence of injury and pain because of a lack of stability.
这些组织的共同活动达到了一个好处，就是我们的肩非常灵活，它几乎是身体上最灵活的一个关节。那它有更多的活动度，但有利有弊。那既然它更灵活，它也处在一个更高、更大概率受伤的这个风险上，因为它没有一个特别强的骨性结构去连接，所以它不是那么的稳定。
And so when we look at the shoulder, I just want to point out something that is often maybe misconstrued or misunderstood in when looking at the shoulder complex, and that's the relationship between the glenoid of the scapula, so the socket itself, and then the head of the humerus. Now, often when people demonstrate this, they will take their hand and they'll cup it over their fist, and they'll say, okay, this is what your glenohumeral joint kind of looks like. But instead, what I want you to think about is a golf ball on a golf tee. So there's really not all that much contact or approximation of the head of the humerus and the socket itself.
有一个经常会被大家误解的结构啊，就是我们的盂肱关节，你的肱骨头跟关节窝的这个连接。我们通常会想，它可能像是你的一个拳头包裹在另外一个手掌中，一个非常牢固的结构。但实际上这个是不正确的。那真实的结构应该像是一个高尔夫球放在这个击球的这个杆上，它是一个非常浅、非常弱的一个连接。
Now, with this unstable position, because if you've ever golfed before, you know that a golf ball doesn't always really want to stay on the golf tee. And specifically, if it's off center just a little bit, it becomes very unstable. And so it can be blown off even with just, a small gust of wind. So this leads to then a increased requirement for soft tissue stability to be created. So with the fascia, the muscles, the ligaments, and the tendons creating stability in that joint.
对，如果你打过高尔夫球的话，你会知道啊，这个连接会是非常的脆弱，或者非常容易被打破，即使是一点风吹草动，都有可能让球从这个杆上掉下来。那实际上，我们的肩也是同样的结构。那为了能够让它更稳定呢，我们需要一些结缔组织的帮忙。对，比如说我们的韧带、我们的肌肉、我们的筋膜和肌腱这些组织共同完成发力，把我们的肱骨头紧紧的拉在关节窝上。
So the position of a joint, specifically we're talking about the shoulder, but really any joint. So the position and the resting position of that joint impacts its ability to express full strength, full range of motion, and have full stability in its functioning range of motion. And the shoulder is no different. And so because it doesn't have a lot of bony stability and requires a lot of muscular and soft tissue stability, the position of the scapula and the motion of the scapula is very important for organizing the position of the actual shoulder joint itself, the glenohumeral joint.
我们身体的关节啊，其实这个关节本身在静止状态的位置，都会影响到它的力量、它的一个活动度、它的一个稳定性。那我们的肩关节也同样如此，但这个时候更多依靠肌肉、依靠结缔组织去控制的这样一个稳定性呢，就会相对比较挑战，因为它没有骨性结构的这个去锁定。那再加上我们的肩胛骨啊，它整个肩胛骨的状态和它的位置会非常大程度的影响我们刚刚所谈到的这个肩关节，也就是盂肱关节。对，整体来说，肩胛骨的功能会影响到我们肩的这个运动功能。
So we're going to talk a little bit later about scapulohumeral rhythm, but I just wanted to define what it is before we kind of move along here. So if we think about the scapula having the glenoid on it, so the actual socket of the shoulder, as I elevate my arm, so I'm just going to imagine that my fist is the ball of the humerus, my elbow is actually my elbow in this case, but as you come up into abduction, for instance, the scapula is actually going to start to tilt up as I move my arm up and around, which is why I can bring my arm all the way up over top of my head. And it's the same thing in flexion. Now, the rhythm of those two bones moving together is very, very important for full function, because if the scapula doesn't move properly, the humerus won't move, and vice versa.
所以首先我们了解一个概念，叫做肩弓节律啊，就是指我们的肩胛骨跟我们的整个肩关节其实会一起去移动。比如说刚刚 Adam 他的左手会是模拟肩胛骨的这样一个结构，然后呢这边的关节窝会长在肩胛骨上，那他的右手握拳会是这个肱骨头的状态，他的小臂呢就现在变成了他平时移动时的大臂。所以当他做一个外展动作的时候，所以各位同学可以尝试，当你做一个外展动作的时候，你的肩胛骨会自然伴随一个上旋，这样确保它有足够的活动空间。那同样，当你做内收的时候，它会伴随一个下旋，意味着这个肩胛骨跟肱骨同时的移动，这是一个正常的功能，并且这个功能是非常重要的。
So controlling the motion of the scapula and the resting position of the scapula are a whole bunch of we call parascapular muscles. So muscles that attach into the scapula itself and then attach to adjacent parts of the body, for instance, the clavicle or the rib cage, the spine, and they help to control, as I said, its position and motion. And so we're going to just discuss a little bit about what we call force couples in just a second here.
所以在这个运动结构的基础上，你肩胛骨本身的位置，它本身的状态就会很大程度影响肩的运动。那我们肩胛骨呢，它本身的位置会根据它叫肩胛旁肌啊，所有与这个锁骨相连、与肋骨相连、与脊柱相连这些肌肉共同的张力，会维持肩胛骨一个自然的位置。那接下来我们来了解一个概念，叫做力偶。
And so what force couples are is very simply just muscle groups that act to perform a particular action in and around the scapula. And so allow it to do things like protraction and retraction, elevation, depression, and then upward and downward rotation. And I know there's several other movements that scapula performs, but it does allow for a lot of different coordinated movements.
好，首先我们来理解一下，那力偶其实简单来说就是一组力来完成一个共同的动作。比如说我们的肩胛前引、回缩、上提、下抑、上回旋、下回旋，它都是由这个不同的一组力来完成的。对，那虽然肩胛骨会有更多的几种功能啊，比如说完整的应该会有10种功能，那我们这里更多讨论的是一些比较单纯的运动，因为很多其他功能会是几种运动伴随发生的。
And so on this slide and in your handout that you have as well, what you will see is there's some muscles here that have stars and there's some muscles here that have kind of almost a T or a plus sign beside them in orange. And the ones that have the star are muscles that are often lengthened, and they're often a little bit weak in that they are not, it's not that they're not working, but they're not working properly. They're not working optimally.
好，我们来解释一下，大家会看到讲义上的这些肌肉，有一些会用星号标注，有一些会用一个小的箭头标注。那用星号标注的指的是这些肌肉通常会是一个被抑制的状态，或者说这些肌肉它的整个运作功能会不太理想。
And then what you also see is, so the muscles that have that plus sign or that T on it, they are the ones that are often overactive and they are often very tight. So they're pulling the scapula into a weird position. And when these two muscles have an imbalance in not only their strength, but also their activation levels, you start to see that the scapula gets pulled into a weird or an awkward position, and that can lead, as we mentioned earlier, into dysfunction in the actual shoulder itself.
好，那么另外一种用这个小的箭头标注呢，就是指这些肌肉通常会是过度活跃或者是过度紧张的。那你就会发现，如果我们的整个一个功能上，它的主动肌跟拮抗肌，它的紧张程度不同，发力程度不同，就会产生一个问题，它的肌肉会紧张的肌肉会带着肩胛骨去跑到一个不太正常的位置上，这个位置就会影响到未来的一些运动的能力。
And so by looking, if you've kind of scanned this entire list so far, what you probably see is that in all the movements, well, the muscles that do protraction are synergists or stabilizers in that protraction move, in retraction, and then vice versa. So the ones that are antagonists in protraction are stabilizers in retraction. And so there's kind of this push and pull or balancing act that these force couples have to undergo.
对，那我们的力偶其实会有个规律啊，就是你会发现在前引动作中的主动肌，那到了回缩中就会变成了拮抗肌，所以都会变成一个互相交换的状态。那它主要发力的时候的功能就会与肩胛骨另外一个功能去对应起来。
And so I mentioned at the beginning that there's a common pattern that you see in most shoulder injuries or shoulder dysfunction. And so what I just want to point out are that the muscles that are commonly either weak or inhibited, so aren't quite working properly, are almost always the same when it comes to scapular dysfunction. So it's the serratus anterior and it's the middle and lower traps that are often not really working properly.
好，还记得我们在课程刚开始讲过啊，这很多的肩痛的客户，他其实问题都很相似，他的肩胛骨都处在同样的一个状态，那基本上都是前锯肌无力或者紧张，再加上他的中下斜方无力紧张的这样一个状态。
And then on the other side, we also have the same muscles as you look through the list that are often tight and a little bit overactive. So they're a little bit too strong. They're working too hard to hold you in this position. And these are things like your upper trapezius, your levator scapulae, and your pectoralis minor, and often pectoralis major as well, but we'll just stick with the parascapular muscles, the one actually attaching to the scapula.
所以与这个刚好相对的，就是有些肌肉会一直处在比较紧张、过度发力状态。那其中一个就是我的上斜方，还有的肩胛提肌。那通常还有胸小肌，还有说胸大肌也会处在一个比较紧张的状态。那通常这些肌肉它会过度紧张。
And so what we'll be looking at when we're trying to do our assessment and then actually addressing some of this dysfunction is we'll be looking at releasing some of those muscles that are tight. So the pectoralis minor, the levator scapulae, and the upper traps. So how do we remove them from what we do with a lot of the movements that we do so they're not causing compensation? And then how do we now activate or reintegrate some of the muscles that aren't working properly, such as the serratus anterior and that lower and middle trap?
所以我们解决的思路也会比较清晰，那就是我们会将紧张的上斜方、肩胛提肌、胸小肌先进行松紧，避免它们在我们后期的训练中产生代偿、过度参与。那再把一些平时发力状态不理想的，比如说前锯肌、中下斜方进行合适的激活，让它们能够正确的发力。
So let's now talk a little bit about what is known as scapular dyskinesis. And that is, I just realized that is not spelt right. We're missing a P. But scapular dyskinesis. And this is an all-encompassing term for really just altered positioning and altered motion in that scapula. And if you break down the word dyskinesis, it means dysfunction or a lack or altered movement. And then kinesis is obviously the movement piece.
好，首先我们来解释一下什么叫这个肩胛的动力障碍，或者说力学异常。那其实就是指我们肩胛骨本身的位置发生了变化，以及它的运动的功能发生了变化。
Now, scapular dyskinesis is not actually an injury itself. So it's not actually something that is causing necessarily pain in and of itself, but it can lead to altered glenohumeral joint alignment. So as we talked about, if the scapula is in a poor position, then that shoulder is also in a poor position. It can also lead to abnormal stress on the actual shoulder ligaments themselves. And altered subacromial space, so impingement in the shoulder.
所以这个力学结构的变化或者运动的变化呢，本身可能不是一种疾病或者是一个损伤，但它会带来一些问题。第一个就是会让我们的，比如说肩关节，它的位置会产生变化，没有在一个更好的对位状态，然后会造成一些韧带的过度的牵拉，然后这个时候就可能造成一些肌群异常的这个紧张。
It can also lead to an overload of the acromioclavicular joint. So the joint that actually forms the tip of the shoulder. And when we overload the acromioclavicular joint, we lead to increased propensity or increased occurrence of shoulder separations. So either from contact or from lifting, as well as perhaps even just pain in the top of that shoulder.
所以这也可能造成一个问题，就是让我们的整个肩峰附近的这个压力变大，有可能造成我们的肩更容易脱位，或者是造成一些撞击啊，产生疼痛。
And then we'll also see there's an increased strain on the scapular stabilizing muscles. And so if you think about where most clients maybe get trigger points or get some pain in the musculature in and around the shoulder. Well, often it's either in the upper traps, right? So the top of the shoulder, the levator scapulae, which is attached from the neck down to the medial superior border of the scapula there. And they often get trigger points in there. And then same thing, right in the front of that shoulder, right by the bottom of the clavicle, which is where that pectoralis minor is. So people often understand or notice that that's where they're getting pain. They may not necessarily understand why though.
好，那这个动力学的障碍呢，或者是运动的变化，同样会导致一些组织的张力异常。比如，经常你的客户会告诉你，他感觉到紧张或者感觉到酸痛的。那第一个就是在颈部后方的这个上斜方肌感受到很多的酸痛点。那还有一个就是肩胛提肌会从你的颈椎连接到你肩胛骨的内侧缘。那还有一个就会在正面，在你锁骨的下方，也就是我们胸小肌的位置。他可能明确的知道这几个肌肉很紧啊，每次按上去都很痛。但他不会理解是什么原因造成了这些肌肉的张力过高。
So we should already know, just from kind of what I've said so far, that scapular dyskinesis is probably something that needs to be addressed. And oftentimes it is a precursor to pain actually coming in and taking hold of the shoulder. If you've been to any of the other sessions that I've done, you may have heard me say this before, but pain is the last signal your body gives you that there's something wrong. It's kind of that stop point. It's your body saying, okay, we're done here. This is painful. So now I'm going to provide you with pain until you fix all this stuff that's going wrong.
好，所以这个力学的变化其实是会导致一些疼痛啊，或者它可以理解为是疼痛的先兆。那如果你有听过 Adam 其他课程，你会发现他说一句话，就是疼痛是我们身体给到我们的最后一个信号，或者最后一道防线。那出现疼痛的时候，它其实在告诉你，你需要立刻停止你所做的这个行为。那我们希望的是，可以在疼痛出现之前，先解决一些能够观察到的这个问题，比如说就是这个动力学的异常。
And so our job as personal trainers, as strength and conditioning coaches, as fitness instructors, as whatever your title is in the fitness or rehabilitation industry, is to assess kind of what's going on specifically surrounding the motion of the scapula and the shoulder, and not just look at end range, because your body can compensate to get you into this overhead position by maybe elevating your shoulder before you get up to give you a little bit more perceived upward rotation of that scapula, but you're getting it from a poor pattern. And that can lead to injury down the road. So we want to be able to look at what's going on at the scapula and how is that going to affect shoulder motion and overhead motion as we progress through an exercise program.
所以对于我们来说，无论你是一个私人教练、体能教练，还是健身培训师，无论你的角色是什么，那我们希望具备一种能力，就是去评估肩胛骨的一个状态。因为通常我们来说，我们可能会简单的评估它动作的末端，比如说看它肩屈。肩外展能到什么幅度？但实际上人体很聪明，它会通过预先的抬起肩锁关节来帮你达到这个活动度。所以实际上很多时候，虽然它能到相同的活动度，但它的动力学的这个结构是不一样。我们需要能够判断出肩胛的运动是否正常。
So let's just talk about a couple of the mechanisms involved in scapular dyskinesis. So the first one listed there is the inadequate serratus anterior activation. So the serratus anterior, if you don't really know your anatomy all that well, it's the muscle that kind of comes around and looks like a serrated blade on this kind of upper outside part of the chest. So it kind of looks like fingers or a serrated blade here. And it wraps around along the line of the rib cage, goes underneath the scapula, and attaches to the medial border, so the inside border by the spine of that scapula.
所以首先我们来看一下肩关节这个力学障碍或者是动力学异常，经常会有一些机制。那其中第一个就是前锯肌的无力。那如果你对解剖还不是特别熟悉的话，我们来解释一下，前锯肌呢会有点像一个锯齿一样，在你肋骨的外侧。然后它会一直向后连接到肩胛骨的内侧缘。
Now, one of its primary roles is upward rotation of the scapula, so allowing for upward movement as I go into abduction or flexion, but also to provide a almost a posterior tilting or a force to hold that scapula against the rib cage. So when it's not activating in the way it should, if it's too weak, what you'll often see is a very, very poor position and less upward rotation and less posterior tilting of that scapula. So allowing it to really get into a very poor and vulnerable position.
好，那前锯肌它主要的作用呢，第一个是当我们做外展、做屈的时候，它可以提供一些个上回旋的力量，所以它会让肩胛骨向上旋转。那其实还有另外一个很重要的功能呢，是它会提供一个把肩胛骨拉向你胸廓、拉向胸廓的力量。这个动作呢是肩胛骨的后倾。那如果你的前锯肌力量会比较弱，会出现的就是当你做肩关节运动的时候，你的上旋能力较差。再加上你没有足够的力量把肩胛骨紧紧的拉在你的胸廓上，所以这个时候它可能会是一个翘起的状态，在一个很容易受伤的位置。
So another mechanism that you can see as well is excess upper trapezius activation. So the upper trap, which goes from the base of the skull and the neck down actually to the clavicle, you can see that it starts to fire up a little bit more. Now, the reason for this is actually to get the shoulder in a better position in order to pull up. And you start to see that the elevation of the clavicle actually starts to rise. So people who have really, really tight upper traps, or they have maybe when they row or they elevate their arm, you'll see that the shoulder will kind of pop up before they pull because that upper trap is trying to upwardly rotate the scapula and take the place of that serratus anterior.
好，那么第二个经常出现的机制呢，是我们的上斜方激活，上斜方过度激活，就是它过度紧张。那这个时候会造成它整个，因为它连接在我们的头部后侧，一直到肩胛骨啊，一直到我们的锁骨，所以它可能造成的是它过度紧张呢，会把整个肩向上抬。你会发现很多客户在尝试做一些外展动作或者做划船动作的时候，会先把肩向上抬，然后再做后续的动作。这个时候就是它会优先的启动啊，完成一个关节向上的这个动作。
Now we also see, and we mentioned this with the force couples slide, that there's also a lot of pectoralis minor tightness. And this is not a muscle that is really talked about a lot in movement, but when it comes to the position of the scapula and pain in the shoulder, it's very, very important. And so when we have excess tightness in that pectoralis minor, which goes from basically the tip of the scapula and comes underneath the clavicle and attaches to the rib cage just inferior to that clavicle, you start to see that the scapula gets pulled into an anterior tilt, meaning that the bottom tip of the scapula comes out from the body. And then you also see medial rotation as well. So you start to see the medial border of that scapula.
好，所以呢，接下来一个机制呢是我们的胸小肌啊过度紧张。刚刚在这个利偶的表格中也有看到，胸小肌紧张是居多的。所以这个时候，当胸小肌紧张的时候，会发现几个问题。第一个呢，它从肩胛骨的后侧穿过我们的锁骨，连到肋骨上。所以当它紧张的时候，会造成的是把肩胛骨呢向前拉。那向前拉之后，你会发现它肩胛骨下角有可能会被拉起来啊，这个状态也是很容易造成一些损伤。
So when you combine just those three mechanisms, what you start to see is that all of these muscles are almost trying to compensate for each other because there's a lack of movement somewhere, there's too much activation somewhere else, and the position of that scapula is really in a very abnormal position. So it's anteriorly tilted, it's medially rotated, and that serratus anterior isn't working, so the upper trap has to work really hard in order to bring you up. And so what we want to do when we're looking at addressing this positioning and this movement dysfunction is we want to be able to assess, okay, what's the position of the scapula and its current movement? And then how do I then get into all of those muscles, relax the ones that are overactive, and then activate the ones that are underactive?
所以你会发现，刚刚几种机制啊，最终结合在一起，就会是一个互相代偿、互相去替代依次的功能这样一个状态。你的肩胛骨会在前锯肌无力的情况下，更多的前倾，然后会伴随着一些内旋， 然后这个时候呢，上斜方会更容易启动，优先去发力，胸小肌会一直保持紧张。所以我们需要做到的是，当你理解了这些机制，那我们能够通过一些方式来评估，来看看到底哪些肌肉是紧张，哪些肌肉是可能被抑制的，它的发力状态不理想，然后我们再去给出一些解决的方案。
Now, the last two mechanisms here are quite simple. So the first one is that you have a posterior glenohumeral joint tightness. So the soft tissue in the back of that glenohumeral joint is becoming tight, and that's actually pushing the humeral head forward. So a lot of times when we just look at static posture, and we'll do this a second when we're assessing the posture, but oftentimes we see that we could almost see the head of that humerus sitting forward in that glenoid. And that's because all the posterior soft tissue's really gotten tight and pushed it forward.
那第四个机制啊，其实非常好理解，就是指我们整个肩关节的后侧会是一个比较紧张的状态。那这些后侧肌群的紧张会出现一个动作，就是他们会把你的肱骨头向前推。那很多时候我们在做体态评估的时候，可能轻易的可以看出来，它的肱骨头相对于肩关节会是一个在前侧的状态，这是主要由于后侧的这个肌群张力过高，把它向前挤出去了。
Now, because of this tightness, and because most of the muscles in the posterior of that glenohumeral joint are actually attached to the scapula, they can pull that scapula into some anterior tilt. So when I tighten here, it actually pulls me more into an anteriorly tilted position in the scap, which is not a position, and I think we know this as trainers and exercise professionals, that we don't want that position in the shoulder because it's going to lead to decreased amounts of movement.
这些肌群的紧张同样会造成一个动作，就是肩胛骨的前倾啊。刚刚 Adam 的示范，就是你的整个肩会更向前跑，然后同时伴随着肱骨头前移。那这个对于健身教练来说，对于这个体能教练来说都知道，这不是一个比较理想的位置，会造成我们整个肩关节的活动受限。
And then the last point here is that we see that there is a lot of motion or a really poor posture, in the thoracic spine. So a kyphotic or a flexed posture can lead to a lot of dysfunction in that shoulder. So I just want you to try this for yourself for a second so that you can understand what this kind of does. So what I want you to do is I want you to just first stand with a nice upright posture. And I want you to bring your arms out to the side with your hands facing forward.
好，所以最后一个点我们讲到的是胸椎的曲度过大，我们希望大家可以一起来感受一下这个变化。所以首先需要各位站好，把你的胸椎伸展啊，抬头挺胸，然后把双手抬起来，像 Adam 一样，两边曲肘与肩部放平。
Now, in this position, I want you to make sure that your rib cage is down and that your scapula is set in a really good position.
然后确保你的肋骨没有向外翻出来，肩胛骨没有做太多的这个不正常的运动。
And so what we're going to do is we're going to keep our elbow where it is, and we're going to go into some internal rotation. And we're just going to check how much rotation you have, and everybody's going to be a bit different.
我们来尝试一下，在胸椎伸展、肩胛中立的状态，你的内旋大概有多少？这意味着你把手向下转。
And try not to allow your shoulder or your scapula to tilt forward. So in internal rotation, your scapula is going to want to do some anterior tilting. So I want you to just make sure that that shoulder stays open and only go as far as you can without tipping into this position.
确保我们在测试内旋的时候，不要做肩胛的前倾啊，你的肩不会有太多的这个旋转向前的动作。
And then from here, what I want you to do is go now into external rotation. So come as far back as you can, once again, without allowing the rib cage to flare up.
然后在内旋之后，我们来测试一下外旋，所以同样保持肋骨不会外翻，胸椎伸展，肩关节的稳定。
And just take a mental note of how much range of motion you have. You should have about 90 degrees of rotation. So you should be able to get into 90 degrees of full rotation between your internal and external rotation.
Sorry, 90 degree?
90, yeah.
You mean 90 for external?
For both. So between where I am here, 180. So where I'm here versus where I am here, I should have, 180 degrees. in
对，
total.
这比较理想的肩关节呢，应该会是内旋到外旋的最大幅度应该有接近180度这样一个幅度。
So then what I want you to do is, now that you have a mental note of where that range of motion is, I want you to get into a flexed or kyphotic thoracic spine position.
刚刚是一个非常好的中立位啊，现在尝试让各位做一点点刻意的含胸驼背状态。
And we're going to do the exact same test. So we're going to be in this flexed position. We're going to have our hand up. We're going to go into internal rotation. What you'll probably notice is that you have a lot more internal rotation. And then I want you to go into external rotation as well.
好，你会发现，当你含胸驼背之后，你的内旋幅度可能会加大。比如说 Adam 刚刚从大概70度，现在到了90度。
And what you'll notice is you've got really good internal rotation, but now your external rotation is gone. You've now lost the ability to go into posterior tilt and really get that scapula into a good position.
但你会发现你的肩外旋的能力受限，被卡住了。因为这个状态下，你的肩胛骨没法做到很好的后倾，它被卡在了一个前倾的位置上。
So this is something you need to keep in mind when you're working with a client who may have a kyphotic spine, whether it's due to working at a desk or perhaps they have been just sitting in chairs for long periods of time. Maybe they are a truck driver. But you have to be mindful that somebody who has this position, if they can only externally rotate to here, well, they're not going to be able to press overhead up here, right? They're not going to have that range of motion without maybe getting it from the spine instead of the shoulder.
所以这个时候，作为教练，你就需要非常关注。如果你的客户长期久坐啊，或者是他有可能是这个司机这样一个职业，他可能会处在一个含胸驼背的状态。那这个时候，他的外旋不足，意味着他永远不可能推到过顶位。所以我们需要先解决胸椎、肩胛的问题，再尝试一些过顶训练。
So the position of the joint, so the position of that scapula is very, very important for the overall range of motion that I can have. So it's important for me as a strength and conditioning coach and as a personal trainer, and for all of you, for your clients, to make sure that the joints are in a good central position. So we call it joint centration, where there's optimal pull from all sides and optimal movement available. We have to make sure that all the joints are in that position in order to allow for optimal function.
所以对于教练，对于我们来说，需要非常注意的就是，我们需要关注胸椎以及肩胛骨的位置。那只有这些位置正确了，我们才能做到的就是关节处在一个共心或者共轴的状态，那可以有最大的拉力，能够最大承受力量，并且它有最大的运动幅度。
So what we're going to do now is we've talked a lot about scapular dysfunction. We've talked a lot about some other things going on in the shoulder, about the shoulder mechanics. So what we're going to do now is walk through a short little just assessment protocol that you can use for scapular dysfunction. Now, we're going to go through a lot of different tests. You do not have to do all of these tests, but you can pick and choose which ones that you do. The key is that you are walking through this process of looking at posture first, then observing movements, and then looking at, are there any special tests that I need to do to assist with assessing this client?
好，刚刚我们聊了很多关于肩关节的结构啊，它的力学异常。那么接下来我们来看看肩关节的评估。那我们会做一系列的评估啊，大家不需要全做，但我们希望的是你可以根据这样一个顺序，就是先评估姿势，然后你会观察动作，再决定是否需要一些特殊的这个关节的测试。
All right, so I'm going to bring Jen out here, and we are going to just do a quick little evaluation or assessment for scapular dysfunction. Jen, China, Jen.
好，我们会请 Jen 配合我来做一些快速的肩胛评估啊，所以 Jen 再给大家打招呼。
Now, you may already do a static postural assessment with your clients. I hope you do. Most of the time when I'm assessing posture, I don't do it with them just standing. I watch them walk in. I watch them just kind of stand as I'm talking to them. And I use that as my assessment because I don't want them to know I'm assessing their posture. People always change things.
好，所以希望各位会对客户做一个静态筛查、静态姿势评估，这个是非常重要的。那个人来说，我会从客户开始走进门啊，一直到跟我交谈如何站姿， 在整个过程中去评估他的姿势，因为我们不希望非常刻意的告诉他，好，接下来我们要评估你的静态姿势。这个时候，任何人都会有一个刻意的调整，只有他的自然状态，我们才会发现最真实的这个问题。
So we're just going to focus on, we're going to look at 3 different positions, and I'll explain why we look at all these. And we're just going to focus really specifically about on the shoulder and this upper thoracic spine position. And so from the lateral view, what we're going to first start to look at is probably the same thing that you would look at in this position. Is I'm going to look at the spine curves.
我们会从3个角度来看它的整个这个上背啊，或者是肩胛。首先，我们从侧面，侧面看呢，我们首先看的是它脊柱的一个曲度。
So hopefully you understand that there's 3 primary curves that we can see. We have our lordotic lumbar curve, we have our kyphotic thoracic spine, and then we have our lordotic cervical spine as well, or at least that's the way it should be. But there are varying amounts of each of these positions or each of these curves that we should see. And so what we have to understand is what is normal versus what is abnormal or dysfunctional when it comes to those curves.
好，首先这个曲度我们需要理解的是，那人类自然的脊柱曲度啊，会是一个腰椎前凸、胸椎后凸、颈椎前凸的这样一个状态。那我们只有知道正确的结构是什么，才能判断出来什么是不正确的、异常的曲度。
So I'm not going to go into too much because there's so much variation or variability in clients with regards to how much curve they have. But as you see more static posture and more spine curves, you'll start to understand what is normal and what is maybe a little bit too much. Jen here has a pretty good lordotic curve. She's got a good, very gradual kyphotic curve, and then she's got a good cervical spine position. Right? So she may be slightly forward head, but not too much that I'm going to be all that concerned. So the thoracic spine, when it comes to the static position right now, doesn't worry me.
好，所以希望各位可以通过多实践啊，看多了之后你就知道怎样的一个曲度会是比较正常，怎样的曲度可能会是需要调整。那就 Jane 来说，它有很好的一个腰椎自然曲度，胸椎会是一个很缓和的向后凸，颈椎也会自然的曲度，可能稍微有一点点颈前引。但这个还不足以到这个需要比较紧急的调整的状态，所以对我来说，他的胸椎没有什么问题。
So now I'm just going to get Jen to turn so she's facing the wall so you can see the back of the shoulders. And we're just going to do a quick little static postural assessment of particularly the scapular position. So just really looking at, okay, where is the inferior border? So where's the bottom of that scap on both sides? Is it even on both sides, which it is? And then what is the kind of angle? So how much of this medial border can I see? So if you really look at this, you can see that this right scapula sits out a little bit further. So hopefully you can actually see that because she's a great demonstration of this postural position.
好，所以然后我们让 Jane 转身啊，看到她的背面，我们需要观测一下她肩胛骨的位置。首先，我们看到肩胛骨内侧的下角，那看它是否对称，处在同一高度啊，脊柱的距离是否相同，那这个 Jane 是没有问题的。然后再向上看内侧缘，那如果大家可以通过视频看清楚的话，其实 Jane 的右侧肩胛骨它的内侧缘会相对更靠外一些，这个希望可以通过视频看出来，因为 Jane 是一个非常典型的这样一个肩胛骨的位置。
Now, often when people see something like this, or they see the shoulder rolled forward, they often think that this is a retraction issue, that I've got to work a lot of pulls to get into the rhomboids and mid-traps to pull that shoulder back into the center. But the issue isn't that there is a lack of retraction. It's actually that the shoulder blade should be pushed in to the actual rib cage itself to flatten it out. And then relax. Right? So you see that she's actually able to contract the muscles that need to be contracted to hold it there. So she's not contracting in here. She's actually pulling that shoulder blade. And I'm just going to show you this from a side view. Just relax. So right now you see the front of the shoulders in front. It's kind of pushed forward. And if I just relax. I'm going to do it. And if I just gently pull this scap against her body, so I'm not pulling backwards towards the spine, I'm actually just squeezing back. You see that the front of that shoulder opens up a little bit versus where it was before.
好，所以当出现这种情况的时候，我们通常会想啊，是不是我回缩的能力有问题？我的菱形肌、我的中下斜方力量不足？但实际上，那通常不是这个造成，而是你没有足够的力量让肩胛骨去后倾。那我们请建议刚刚转了个90度，从侧面来看，当他放松的时候，他的肩胛骨下角会明显的往外走。但这个时候我不让他主动发力，而是通过我的手把肩胛骨下角往他的胸廓上去推。那推的同时，你会发现他的肩在慢慢向后走，所以实际上他是需要做到更多的后倾，而不是回缩。
So that's just an important thing to remember about allowing yourself to stop thinking about just doing rows to fix forward shoulders, because we don't want them, if you just turn around, we don't want them to be here. This is not the position we want people. This is overactive. The scap is way too close to the spine now. And this is just not a natural position to be in. We want them to be able to rest with the postural muscles that hold them here, but in a nice, stable position with the scapula. So getting that serratus anterior to be activated, that will pull the middle and bottom borders of the scap in. The lower trapezius will also help with that downward rotation as well. And then releasing that pectoralis minor in the front of the shoulder and getting a little bit less kind of upper trap and levator scapulae activation will also benefit that position.
所以这种情况，未来各位如果碰到的话，我们一个合适的解决方案啊，是我们不做更多的拉跟划船类的动作来刺激我的菱形肌和中斜方，更多是需要我们将前锯肌激活，把你的肩胛骨下角紧紧的拉在你的肋骨上，同时呢，可能会需要把前侧的胸小肌松解，在上侧的过度发力的上斜方和肩胛棘肌进行松解，这样让肩胛骨处在一个更稳定的状态，并且维持住。
Right, so far we've done the lateral view, so looking at the frontal plane, looking at the curves of the spine, primarily the thoracic and the cervical spine. We've looked from the back to see the scapular position, but we still do want to see the front. And often people question, like, why do you want to see the front of the body? And the reason for this is because you actually want to see the clavicular angle, so the angle of that clavicle as it runs from the sternoclavicular joint out towards the acromioclavicular joint at the shoulder.
好，那最后我们会请建议转到正面来看。那很多人可能会想，为什么要看正面？我们已经从侧面看到了胸椎曲度，从后面看到肩胛骨的位置。那在正面，其实我们主要观测的是它锁骨的一个状态。我们看看从它的锁骨近端，也就是我们的胸锁关节，到我们的肩这一端肩锁关节，它整个的一个状态如何
？So what you should see is that there's about a 10 to 15 degree upward angle from the sternoclavicular joint to the acromioclavicular joint. So it should be on an angle up. Any more, and you probably have overactive upper traps pulling and elevating that clavicle up. So we want to probably calm those down. But if it's too flat, that might mean that we actually have a lack of upper trapezius activation, or maybe something else below, such as the subclavius here that sits under the clavicle might be a little bit tight as well. So we really want to watch for the position of all of these bones, because that will give us a little bit more information about what's going on at the shoulder and the scapula.
所以其实我们需要观察到一个正常的角度呢，会是从胸锁关节到肩锁关节会有个10到15度的倾斜，两边会有点像中间的一个小的 V 字形。那这个代表它有正常的一个状态。那如果大于这个角度，那可能说明它的上斜方肌过度紧张，把整个肩锁关节拉起来了。但如果你观察到另外一种相反，就是锁骨是平的，那有可能我们需要反而去强化一下上斜方的这个力量，让它做更多的上拉。或者是锁骨下方的一些肌群可能过度紧张，把它拉下来了。
Now, the next thing that we're going to do is we're going to start just observing some movement. And I've got a very complex assessment that I do with clients when they first come in. I look a lot at the foundational movements. I integrate pushes and pulls and overhead reaches. But just for simplicity today, we're just going to do two different motions. So one is reaching up, So looking at kind of, okay, what's going on with regards to the shoulder, the neck, the scapula as they reach up into the air, and what pattern does the client choose to use? And then we're also going to look at reaching forward and look at how much scapular protraction and upward rotation we have as we reach into the front.
好，所以那接下来我们会来观察一些动作啊。那通常来说，我个人在接待私教的时候，会在第一次在基础测试的时候做很多动作，包括了推拉、过顶、向上抓东西。那今天为了能够更简单，让大家更好理解，我们只做2个动作，一个是向上的触碰，一个是向前的触碰。所以我们会观察这2个动作下，它有多少的这个肩胛骨的旋转，有多少肩胛骨的前引。
So I'm not going to overcoach this. I am going to have her face the wall so you can see the scapula. Now, I don't overcoach. When I'm observing these 2 movements, I'm not going to overcoach them. I'm not actually going to tell her how I want her to do the movement. I'm just very simply going to say, okay, Jen, I want you to reach up over top of your head as high as you can. Good, and back down.
好，很重要的是，在我们让客户做这个动作的时候，你不会给他太多的指令，告诉他你希望他用什么样的方式向上够。我们只会简单的说 ，Jane， 请你双手向上举过头顶，然后我们观察他这个动作是如何完成。
The reason I'm not going to coach it, I'm not going to tell her what to do, and I'm not even going to demonstrate it for her is because I want to see what strategy her body uses to perform the movement, and I don't want her just mimicking or copying what I do. I want her not to think about it just reaching over top of the head. You can even give an external cue and say, imagine that you're reaching for something that's above you on a top shelf that you have to take down and bring back down to the ground. How would you do that, right? So just providing them with almost an image or a picture or a scenario that they can then mimic the movements that they would actually use.
所以我们会非常简单，不会给出指令，甚至不会做这个动作的示范。让他只是根据一个比如比较简单的外部指令，想象你去柜子上拿一个东西下来，然后来看他身体最自然的会采用什么策略、怎样的动作去完成这个指令。
So when I get Jen to do that, I'm just going to have her do that again. So just reaching up as high as she can. The first thing that I notice is that she uses a flexion pattern. So she actually comes up in front to come over her head, which is fine. That's just what her body has chosen. But I'm going to want to assess abduction as well. And the other thing that I'm watching for is what the motion of the scapula is during that motion, as well as the activation of things like the upper traps and the glenohumeral motion as well. So just come down and do that one more time for me. And I'm going to watch it on the way up and the way down. And back down. Good.
好，所以刚刚我们让 Jane 再次做了一次向上。那首先我们观察到的是，他选择了通过屈这样一个策略来实现双手过顶。那这个时候我还会在他上去的过程中观察他的肩胛骨的旋转如何，他的上斜方的这个收缩状态如何。那等一下我们可能还会再观察他外展这样一个能力，但现在这是他最自然选择的一个策略，所以我们可能会需要客户完成几次自然的动作，然后你去观察一些细节。
So with somebody who has scapular dysfunction or scapular dyskinesis, what you'll want to be looking for is, yes, the upward motion that they use with the scapula and the glenohumeral joint is going to be important, but you'll probably see more. And this is why you want it to be just nice, slow, and controlled on the way up and on the way down, is you'll actually see more of the hitching pattern. So you'll see kind of the shoulders maybe stutter a little bit as they come down. And so as they come down, they'll start moving, the scapula won't move, and then it'll kind of pop down as they hit about 30 degrees towards their side. So you just want to be watching for not only the upwards motion, but the downwards motion as well.
那对于一些这个肩部有疼痛或者是肩胛动力学异常的客户来说，你需要不光关注向上的过程，向下最好我们可以做到向上向下都是一个慢速控制的状态。这时候你可能会看到的是，在它下放的过程中，会有一个阶段，可能肩胛骨不动，然后突然肩胛骨会跳到下一个位置，这些都可能是在过程中观察到的现象。
So since in that first one she used the flexion pattern, I'm just going to have her do the abduction pattern just to see if there's any difference with regards to the patterning or pain that she's going to experience as well. Because she might have chosen that flexion pattern because there's pain into abduction, or she might choose, if it was the opposite way, she might have chosen abduction because there's pain into flexion. So I just want to make sure that I assess both of those movement strategies.
好，那么接下来我们会尝试让 Jane 通过外展的方式到过顶位，因为我们希望确保的是，第一个观察外展状态下它的整个动力学的一个机构，那还有就是他之前选择了屈向上，有可能是因为他的外展会出现疼痛，所以这个时候我们希望通过外展来看看是否存在这些相关的问题。那反过来也一样，如果你的客户选择了通过外展第一次向上，你可能需要让他再从屈的角度再尝试向上够。
Okay, and let's go one more time. And back down. Right, so she has really good range of motion, right? So she's able to get biceps very close to the ear. There's really not a lot of extraneous movement, so she's not hiking up her shoulders at all. You do see that there's a little bit of a hitch, specifically on the right side as she comes down. But now obviously she's my wife, so I understand what's going on with her. But she has some kind of neck and shoulder tightness to begin with. And so like she has a lot of levator scapulae overactivation, upper trap scalenes overactivation, and pectoralis minor. So I already know that that's kind of what I'm looking for. And when you're working with a client, understanding injury history, understanding their occupation will be very important to kind of guiding your eyes when you're doing an assessment like this, where there's very subtle movements.
好，那对于评估来说啊，我们刚刚看到 Jane 她无论是通过屈还是通过外展，都能够得到很好的幅度，她的二头可以非常的靠近耳朵。但实际上在过程中呢，右边相对左边会多一些小的这个细节，比如说他肩胛骨会有一个跳动或者是一个卡顿的这样一个状态。但因为 Adam 非常了解他的老婆啊，所以他知道他的整个右侧的肩颈、肩胛提肌，包括这个胸小肌都会是比较紧张，所以他可以很明确的关注在右边跟左边的差别上。那这个时候，未来如果各位是跟自己的客户评估，你需要去了解一些他相关的历史啊，比如说他的日常行为习惯、他的职业、他的一些损伤史。这时候你可以在评估的时候更有一个针对性，知道你该看的可能会看到问题。
All right, so we've now done both of our reaches up in front and to the side, so flexion and abduction. I've seen both those strategies. We've talked about if there's any pain. We've looked at the scapula to see how they're moving. So now the last thing that I want to do is just a forward reach. So this is really not, I don't want to see a lot of kyphosis, so I don't want to see the reach forward with a lot of flexion in the spine. I want her to keep the spine where it is, but I want to see how the scap move around the rib cage. Because often with a lot of clients, what you might see is if they're in a retracted or extended position a lot, they lose the ability to really reach and round that scapula around the rib cage itself. And so this is going to be very, very important, specifically in those who have more of a flat thoracic spine, which is very common in people who play baseball or did as a young kid, or maybe football or any other throwing sport.
好，那么刚刚我们做了2个平面下的这个过顶啊，看到了很多细节。那么接下来我们会尝试做一个向前的动作。那我们向前其实需要关注的是，希望在胸椎能够处在伸展状态，让它的肩胛骨更多的前引，主动的前引，有点想象是你的肩胛骨在绕着你的整个胸廓向前跑，这样一个动作，一个环抱动作。那很多人如果是这个都会是出现平上背啊，或者是平胸椎的这个状态，所以实际上它会丧失一些肩胛骨向前引的能力。比如说很多的棒球手或者需要投掷类的运动员，他们都会出现类似这样的问题。
All right, so I'm going to have her reach once facing away from you so that you can see kind of just the motion of the scapula. And then I'm going to have her do it once as well facing the wall over here so you can see it from the side and them wrap around. So, Jenna. Yeah. Sorry, go ahead, Arthur.
Yeah, you can let James demo. I already translate.
Oh, perfect. All right, so I'm just gonna have you reach in front. So all you're gonna do is just reach as far as you can in front of you without rounding in here. So just watching, now you can see the motion of the scapula. You can actually see how far they get away from the spine. So she's got actually really good protraction around the back. And if you look at the evenness of the motion, and I'm gonna get her to back right up towards the camera here so that you can see this motion a little bit better. Good. And just have you do that again, just reaching forward as far as you can. And you can see that the scap really wrap around really well, and it's pretty even on both sides with regards to how far they are from the actual spine itself.
好，首先我们需要它在一个不主动屈胸椎状态下，尽可能向前够。可以看到 Jane 两侧肩胛骨它的牵引能力非常好，并且让它在拉近之后，你可以看得到，当它到了末端，它两边肩胛骨内侧缘到脊柱的距离是基本一样的。所以这是一个很良好的活动度，加上很对称，很好的对称性。
Right, and then the next one, I'm just going to show you the exact same thing, but from the side view now. So you can just see, like, I would watch both sides. We're just going to watch this right side here as she reaches forward.
好，从侧面再来看一下。
Right, so some good motion as she rolls into that protracted position.
从侧面我们可以更多的看到这个曲度的变化，所以胸椎没有太多的屈，而是肩胛骨主动的向前走。
All right. So that's all I would do for observing movement. So if you're going to add something, it's very simple, flexion and abduction pattern, but let them choose which one they use, see which one they want, and then also just see how far they can get into protraction. So we're assessing really the serratus anterior and how much other interference is coming from the upper traps and the pectoralis minor as they do those two motions with upward rotation and protraction.
所以我们通过一个向上触碰和一个向前触碰啊，可以观察到很多问题。首先，它肩胛骨的活动能力，我们可以一目了然。它的前锯肌能够完成多大幅度的前引啊，它的上斜方肩胛提肌会有多大程度的干扰，我们都可以通过这两个动作去评估出来。Sorry, Adam, I can't hear you. I can't hear you now. Please check your ear.
I'm back.
Okay, now it's back.
Oh, my apologies. So I'm just going to get Jen to sit here, and we're going to walk through a couple special tests now to maybe assess some things that we saw in those previous assessments, such as perhaps we saw them maybe in a kyphotic posture, or we realized that as they got up, they weren't able to get fully overhead. And so we're going to assess specifically thoracic spine rotation in our clients. And so what I'm going to do is just have her sit in a chair, and I'm going to use two bands to create an X in front of her.
接下来我们会来做一些特殊的测试啊，比如说在之前的静态体态评估和动态的这个观察的时候，你发现它的曲度过大，它的胸椎曲度过大，或者是它无法完成一个向上理想的过顶位，那这个时候我们会考虑到是不是胸椎有一些需要进一步评估的，会让它做一个胸椎旋转，坐在凳子上，我会用两个弹力带在它体前交叉啊，形成一个 X 型。
And so what I'm going to do is I'm going to lay one band across the front, so kind of diagonally right in front of her. And then the other band is going to do the same across the front, just making sure that they're actually perpendicular to each other and that the center of this X is in the center of her body.
好，我们把两个弹力带地面交叉，然后把中心刚好对准这个测试者的中心。
Now from here, I like to put something between the client's legs to help really solidify. So use some of the musculature in the legs to hold the pelvis in position, because remember, we're trying to test here thoracic spine rotation. So I don't want motion into that lumbar spine. So you can use anything that you have. You can use a rolled up towel. You can use a yoga block. I'm just going to use a foam pad here to put between the legs. And she can just squeeze into there to really hold the pelvis in position.
好，我们可以在客户的双腿中间放一个小的物体，让它夹住啊，靠肌肉的力量来固定它的骨盆。因为我们希望观察到的是纯粹的胸椎旋转，而不是希望骨盆一起去代偿。所以你可以用一个瑜伽砖，用一个毛巾，用一个垫子去让它夹住。
So for me, I like to keep things really simple when it comes to thoracic spine rotation. I just want to see 45 degrees on both sides. So from neutral, can they get 45 degrees and 45 degrees the opposite side? And so I'm just going to have my client cross their arms over top of their shoulders. They're going to keep their elbows tucked in, and they're just going to sit up nice and tall. So trying to keep that long spine position, and they're just going to rotate. Let's go first towards the right. So just nice and slow rotation, and they're going to stop whenever they feel the first kind of a little bit of restriction or tightness anywhere in the movement.
好，我们很简单，双手体前交叉，手肘向下，然后在一个脊柱延展拉长的状态下，尝试向右边旋转。我们观察它能不能旋到45度。你会在感受到一些拉力的时候停下来。
Right, so from this position, I'm just going to get Jen to rotate towards the right again, just so we can see here. Right, so she feels some restriction there. Now, the key with a thoracic spine rotation test such as this is that you want to make sure that the scapula aren't reaching as they rotate. So you're going to want to really watch the actual thoracic spine. So up near the neck is where you want to be focusing. And she's just a little bit short of 45 degrees going towards the right. So in right thoracic spine rotation.
所以我们需要做的是胸椎旋的时候，肩胛没有去向前引去代偿啊。然后我们观察到 Jane 在向右旋的时候会有一点点不到45度。
All right, and then if I have her go to the left here, right, she has far more rotation on this left side. So she's a little bit past 45 degrees going towards the left. So she's got better rotation towards the left side than the right side, which is very, very common in most clients.
向左旋明显幅度会更大，超过了45度，所以这会在客户中经常见，就是向右旋的能力弱一些，向左旋多一些。
Now, the reason this is common in most clients is because most clients have a dominant hand, and if they play any sports, they will often swing one way or another, or they throw. So they're repetitively doing rotation in one direction over the other. And so most of them have a dominant side with regards to the thoracic spine rotation.
所以通常来说，那我们的客户都会有一个优势侧啊，优势手。那如果他会做一些投掷或者是挥拍、挥棒类的训练，他会长期处在一个，比如说右手优势手向左旋的动作。那旋多了，这个能力就会变强。反过来，左手优势手的发力就会相对更少，所以向右旋的能力就会比较弱。
So there are a lot of additional tests we could do as well, such as muscle length tests or manual strength test or manual muscle testing. I'm just going to show you one because it's one that I love. It's for the serratus anterior, which is often weak. So we're just going to measure the strength of the serratus anterior in more active motion. I'm going to walk through why we set them up in the way that we do. And I'm going to really hopefully teach you exactly how to do this with your own clients.
好，那接下来我们可能会再做一些进一步测试啊，比如说类似肌力测试。那我们今天会分享一个就是对前锯肌肌力的一个测试，因为我们希望你掌握这个方法，可以评估一下它前锯肌的力量到底如何。
All right, so with your client, what you're going to do, now you can have them sitting on the edge of a table or a bench. I'm just going to do it standing. And I'm actually going to move Jen a little bit closer towards you so you can really see what's going on with my hand position. Now, if you think back to your functional anatomy, and I'm going to come down here so you can see me. So if you think back to your functional anatomy and the role of that serratus anterior, it's most of the time when we test it, it's into protraction, right? So you would think about being tested in your ability to create force into protraction. But the problem with that is that there are several other muscles that are often overactive, such as the pectoralis major and pectoralis minor, which also assist in that action and will overpower the serratus anterior and perhaps give you a false reading.
好，那首先前锯肌，我们回顾一下刚刚的这个功能性解剖啊，它主要的功能会是一个前引，很多时候我们会通过前引、主动前引来测试前锯肌的力量。那这个时候 它其实在你肩部、胸部前侧的胸大、胸小都有这样一个功能，而且它们的力量往往会远远超过前锯肌，有可能造成你的这个测试失准啊，你会把胸大肌、胸小肌的力量误以为是前锯肌的力量。
So instead of testing the serratus anterior's ability to protract the scapula, we're actually going to assess its ability to upwardly rotate the scapula instead. And so I'm going to take away that pectoralis minor and major, which are often very tight and can overpower it, and instead work on its upward rotation. So I want about 120 degrees of flexion. So 90 degrees is about here. So another 30 degrees up. And I want the thumb to be pointed up. So I want the hand to be in a neutral position.
Further. Go a little bit further so they can see the whole body.
Okay, go back.
So yeah, close to the wall a little bit. Yeah, much better.
About 120 degrees, yeah, okay. So from here, what we're gonna do is get the arm into 120 degrees of flexion. So about 90 degrees is here, so another 30 degrees up. And this gets the scapula into a little bit of upward rotation and takes away that pectoralis minor and major's ability to be used in this position.
好，所以我们不测前锯肌做前引的能力，而是测它上回旋的能力。我们会让测试者主动做一个肩屈120度，所以跟他肩膀齐平啊，会是90度，然后再往上走30度，在这个状态会有一定程度的这个上回旋。
All right. So once we're in this 120 degree position, I am then going to actually bring my hands down and I'm going to be trying to find the inferior angle. So the bottom corner of that scapula. And that's what I'm going to be assessing with my fingers. So I want to make sure that that doesn't move when I apply pressure up here.
好，所以测试我们会用我们的手找到它肩胛骨的下角，并且把这个下角卡住。我们希望的是，在我做下压的同时，这个下角不会有产生动作。
So in a proper functioning serratus anterior, one that is very strong and able to activate well, if I push on here, nothing should move underneath my hand. I should feel the scapula just solidifies itself to the rib cage and nothing else moves, right? So that's pretty good. I don't see any other movements here. And so that serratus anterior fires on immediately and doesn't allow that scap to move.
所以一个比较理想的发力状态是我们在它的大臂上给一点压力的时候，不会出现任何肩胛骨的动作，会通过前锯肌主动发力来对抗这个拉力，保持它一个上回旋的状态。
Now, in scapular dysfunction and scapular dyskinesis, what you'll see is when my hand is here and I push down, the arm won't move because the deltoids and all the other muscles in the upper shoulder and arm are going to be able to maintain its position, but the scapula will drop a little bit. So because I push on here, the serratus won't be able to hold it. So the other muscles in the upper shoulder and upper arm are going to hold that arm up. So when I press, this will stay where it is and the scap will drop towards the spine.
如果它的肩胛它的动力学是异常状态，可能会出现一个现象，就是当你做下压的时候，这个时候它的前锯肌没有力量去对抗这个力，所以会变成靠它的三角肌主动发力去维持它的大臂角度不变。但这个时候肩胛骨就会向下掉，会出现一个向下回旋的动作。
All right, so just a couple more like finer pieces. When my fingers are here at the scap, I'm not pushing in too hard because I don't actually want to stabilize the scapula. I'm just kind of resting my hand on top, but allowing that scapula to move. And when I push on the upper arm, I'm pushing nice and close to the elbow, but not on the elbow and not above. Remember that this is a manual muscle test. It's not a muscle strength test. So I'm not measuring the strength of that muscle, just its ability to stabilize. So it's just a very gentle push, and she's actually going to initiate the push up as I then push down into her arm. So I'm not trying to pull her arm down to the side.
所以有一些测试时候的细节啊，第一个就是当我们的手碰到它肩胛骨下角的时候，我们的目的不是为了卡住它的肩胛骨，而是感受到它的运动，所以我们不应该给太多的力，影响它运动的能力。然后这边的下压的手呢，会放在它肘关节以上，我们会对肱骨做一点点轻微的压力。而且这个压力的目的不是让他的手能够被你压下去，而是让他前锯肌去发力，去感受到这个力去对抗。所以这是一个人为的这个肌力测试，而不是最大力量测试。
So there's a lot of different ways that you can go with assessing the scapula and dysfunction, but I just think it's important to understand that if you do a static postural assessment, you observe some movement, and then you maybe do thoracic spine rotation or an extension test or something else that you see, and this is going to be different for every client, but if you see something like a kyphotic posture and a lack of motion, maybe you want to assess the ability to go into extension. So you might do a thoracic spine extension test. So the assessments that you choose are not just going to be, well, I do these tests with everybody. There should be some screens that you do that figure out, okay, what kind of things are going on, such as evaluating posture and observing just general movement. And then special tests are for specific clients who you want to find out a bit more information on.
所以实际上大家可能学过非常多的这个针对躯干啊、针对脊柱、针对肩胛的测试。那我们整个的原则就是我们希望先评估一些姿势，然后做一些动作、基础动作的观察。如果你看到客户出现明显的一些胸椎曲度过大，或者是出现一些肩胛位置异常的状态，那我们再会做剩余的特殊测试。所以这个测试不会是所有人测试方式都一样，而是因人而异，会产生一些调整。
So when we're looking at after our assessment and we're looking to get into now addressing some scapular dysfunction, there's a few rules that we want to keep in mind. So the first thing is that we're going to want to move proximal to distal. So what I mean by that is if there is a thoracic spine, either extension or rotation test, I need to address that first. So I need to address the proximal side, so closest to the axial or the middle of the body. And then I'm going to work my way out. So thoracic spine first, then the scapula, then the glenohumeral joint.
好，那么接下来我们做了很多的评估，做了很多的测试。接下来我们来讲一下如何去解决。首先，解决的时候会有一些很重要的原则。第一个是从近端到远端，比如当你观察到一些问题比如肩胛位置的问题、胸椎的问题、肩关节的问题，那我们会先解决靠近你身体中轴的，也就是先解决胸椎，再解决肩胛，最后再解决盂肱关节，按照这样的顺序，从近到远。
Often rehabilitation, or if you go into a fitness facility, people with shoulder pain will be given a lot of rotational exercises for the rotator cuff, which aren't necessarily a bad thing, but this doesn't follow this proximal to distal rule. So really we're focusing on the joint that has pain. We're doing some rotational exercises, but I want you to think about it this way. If the scapula, where all of those rotator cuff muscles are attached to, isn't stable or isn't properly positioned, then you doing rotations really isn't going to help the movement of the shoulder, which is probably causing the pain.
所以通常来说当我们肩受伤，有的时候会收到一些这个训练计划，就是做主动的旋转来激活我们的肩袖肌群。但这个时候你想想看，肩袖肌群都连接在你的肩胛骨上。如果你肩胛骨的位置不做调整，那你做这些旋转训练其实并不会起到一个纠正或者是一个积极的效果，反而可能造成更多的这个疼痛问题。
So the next thing to understand after we understand the principle of proximal to distal is now looking at, okay, we're going to then start our focus on posture. So we mentioned the thoracic spine, but also scapular position and the balance of all of those force couples. So making sure that the resting position of that thoracic spine, scapulothoracic joint and the glenohumeral joint are all properly organized to allow for optimal movement and therefore stability and strength to be added on top.
在遵循了第一个由近到远的原则之后，我们会再关注下一个，就是我们首先关注静态姿势，在静态状态下，它胸椎的曲度如何，肩胛骨的位置如何，以及整个肩关节附近肌肉的张力如何，所以它的力友关系是否正常，这个是我们下一步需要去调整。所以只有在它在静止状态，或者是在一个最长时间维持的状态，处在中立位的时候，它才能承受更多的力量，提高更好的稳定性。
Now, the positioning of the scapula and the balance of the force couples is going to involve two different steps. So one is looking at getting some manual or soft tissue therapy. So whether you do your own, maybe with a Theragun or with a lacrosse ball, or you go to a manual therapist, such as a physio, a chiro, or a massage therapist to kind of work in those tighter muscles and just get them to calm down a little bit. That will be beneficial for helping to improve the positioning of that scapula.
所以对于我们整个位置的一个改善啊，其中一个很重要的就是去松解。比如说，你可以自己拿一个筋膜枪，拿个筋膜球去松，你也可以去找到物理治疗中心啊，找到物理治疗师帮你去松解。那所有这些肌肉张力的下降和松解都可以帮助你回到更好的位置上。
Once you've gotten this manual therapy and you've worked on all those different types of things like the pectoralis minor, major, your upper traps, your levator scapulae, and they've calmed down a little bit, what you can do then is really start to work on the smaller muscles that are often weak. So the serratus anterior, the lower and middle traps, and get them working properly. And we're going to show you a couple exercises to do that.
所以当你把这些高张肌群松开之后啊，比如胸大、胸小、肩胛上斜方、肩胛提肌松开之后，这时候可以开始关注一些小肌肉的训练，也是我们常常无力的中下斜方以及我们的前锯肌，会给大家示范几个训练的动作。
All right, so I'm just going to bring Jen back out here.
再次请上我们的 Jane 来帮忙演示一下。
And we're going to show you just a couple quick exercises. Now, with our general programming, like we could do a whole 8-hour course on just addressing the scapula and its force couples. But what I really want to focus on are two particular muscles and the process that we use. So we always move from a open kinetic chain and into closed kinetic chain with no load, and then we add load in a closed kinetic chain environment.
好，所以这个关于肩胛附近力有的调整啊，或者是肌肉训练，我们可以讲上一天。那今天我们会讲几个比较简单的，都会是遵循着从开练到闭练，刚开始都是一个无负重状态，然后再进阶到有负重的闭练训练。
So I'm going to show you an open kinetic chain lower trap exercise, and then I'm also going to show you a closed kinetic chain serratus anterior exercise as well. And then I'll show you a grouping, so a progression where we can link those two exercises, those two muscles together into movement that will help us balance some of the force couples.
好，所以我们会教大家一个开练的中下斜方训练和一个闭练的前锯肌训练，再把这两个动作组合起来，然后看看我们如何让这两个肌肉一起来运动。
On your stomach. So I'm just getting Jen here to lie down onto her stomach, and the arms are going to be up over top of her head. Right? So lower body, I'm not really concerned with. This is just going to be in any position. We're really just focused on the shoulders right now. When you're working in rehabilitation, the line of force or the line of the fibers is very important when you're trying to work on activation, balancing, and really emphasizing a particular muscle over another.
所以接下来我们请前眼俯卧啊，趴在地上。那这个时候下肢的状态其实不是太重要，我们主要是关注肩关节。那当我们做一些激活训练、一些比较精细的训练的时候，其实整个力线、整个角度是非常讲究的。
So the lower trapezius, if you look at any manual that has anatomy in it, you'll see that it runs kind of diagonally from the scapula all the way down into kind of the mid-lower thoracic spine. So it's angled on a downward trajectory. Sorry, it would be this way, right? On the back of the body. And so that's the direction, that's the angle that I want the arm to be at. So we're actually going to come out a little bit, not quite to 45 degrees, right, but just above 45 degrees. So if this is 90, we don't necessarily want to come all the way to here. We want to be just up a little bit more. So we're in line with the actual muscles line of force.
好，那如果你看过一些书籍中的解剖啊，我们的整个中下斜方会是从肩胛骨斜向连接到这个下半部分的胸椎段，所以它会是一个斜向的角度。那我们希望的是我们的肩跟手臂可以跟它的角度一致，所以会是一个略微不到45度的状态，所以跟它做到力线相同。
So for this exercise, we've got the thumb pointed to the ceiling. So palm is neutral. And all I'm going to get Jen to do here is we're going to make sure that we initiate the movement from the scapula. So really pulling the scapula down and in towards the spine. And we're going to focus also on opening the front of that shoulder. So as she lifts the arm, we're not getting just glenohumeral motion, so where the shoulder stays where it is and the arm opens up. I want them to pull with the scapula and then open up the front of that shoulder. So ideally, I don't actually want the hand to lift higher than the shoulder itself.
所以接下来我们会让他的中下斜方主动发力啊。第一个是把肩胛骨向靠近脊柱，并且更靠下的方向去拉。然后这个时候我们需要做到的是不能让肩保持不动。如果肩胛骨在一个向前的状态，但肩只做这个向后的话，那不是我们想要的发力模式。所以我们希望的是它整个肩胛骨会带动肩关节一起动。那一个能观测到理想状态就是他的手有可能并不会高于肩膀。
All right, so thumbs up, we're going to start with activation pulling down, and we're just going to allow the shoulder to open a little bit. So you notice the hand isn't above the shoulder. You can see a lot of really good activation and movement, and that scap has come a little bit into retraction, but also that downward tilt and downward rotation is really what you're looking for, because that's a couple of the primary actions of that lower trap are downward rotation and posterior tilting.
所以我们希望观测到的动作是肩胛骨回缩，有一点下回旋，最主要的是后倾。通过这3个动作来让它中下斜方充分的发力。那大拇指保持朝上，手掌处在一个比较中立的状态，所以这个时候他的手应该不会高过肩关节。
So with this exercise, and this is also known as a Y, so you can do this while you're kind of bent over, you can do Ys. We're just doing single arm right now for simplicity, because if you have a client who maybe has an injured shoulder, you want to really get them to focus on one side at a time so that they don't, overcompensate with one arm over the other. You just want them focusing on the injured arm at that time.
所以有可能大家知道这个动作叫做 Y 字，对吧？但为什么我们之前只做了一侧呢？第一个原因是为了更好理解这个动作。那还有一个原因就是很多客户有可能会使单侧肩关节出现了受损。那我们希望他把更多身体的注意力放在单边，更好的控制这个动作的完成。
All right, so you would obviously add some progressive overload to this, meaning that maybe we start with just 6 to 8 repetitions for about 3 to 4 seconds of a hold. And we're really just looking to get a little bit of fatigue in the right place. So she shouldn't be feeling this in the shoulder itself. She shouldn't be feeling this in the front of the shoulder specifically. She should be getting a burning sensation in and around the bottom and inner side of that scapula, maybe even right underneath the scapula. And that's kind of where I want her to be feeling it. So when I'm asking her, where do you feel this? How does it feel? That's the kind of information that I want to get back.
我们会在客户训练的时候时刻的去关注他的感受啊，询问他的这个发力点。我们应该感受到的是你整个肩胛的下侧，甚至是这个内侧会产生一些酸痛，而不是整个肩关节的前侧出现主动的发力。那我们可以一组做6到8次，然后根据这个超负荷进阶原则，再去把训练量进行调整。
And then from here, you'll work towards about 12 to 15 repetitions for 4 to 5 second holds. And that should get, as they have progressed through and gained some more, not only activation, but some endurance in those muscles as well. That should provide a really good amount of force and feedback that force couple will start to even itself out.
所以我们可以从6到8次慢慢进阶到12到15次，每次可以在顶端停顿几秒钟。那慢慢的这样的训练呢，第一个是可以充分的激活它的中下斜方，那还可以提高这些肌肉的肌耐力。那随着这样的训练的开展，它会改善整个肩附近的力友关系，让它慢慢的再平衡回来。
All right, so that is our open chain exercise. Now we do a whole bunch of other open chain exercises as well for some of those other muscles, but because of our time restraints, we're just going to move on to a closed chain serratus anterior exercise on the wall. So I'm just going to get Jen to come to her feet, and she's going to come to the wall with her elbows slightly below her shoulders and pressed into the wall here.
刚刚会是一个针对中下斜方的开练训练，其实还有很多选择，时间关系我们就讲一些比较经典好用的。 那么接下来会是一个臂练前锯肌的训练。我们需要 Jane 面对墙，把她的手肘略低于肩膀，并顶在这个墙面上。
So we're going to work here on the serratus anterior. Now it's closed chain because my forearms are against the wall and they're not going to leave. And we're going to work a little bit on the protraction and then upward rotation. So really a short range of motion for that serratus anterior. So from this position, nice and relaxed, I'm actually going to have her almost push into the wall as if she's trying to push the wall away from her. And you'll see the same as when she was doing her reach forward, the shoulder blades are wrapping around the body.
接下来会是前锯肌的激活啊，所以我们会需要它做前引加上上回旋两个很小的动作。那因为我们的手被固定在墙面上，所以这是个臂练。当我们给 Jane 一个指令，用力把墙向内推的时候，你会发现她肩胛骨主动做了一个前引。
So in this position, I already have some serratus anterior activation. But what I'm going to do now is have her go into some upward rotation as well. So while maintaining this protracted position, we're just going to go one arm at a time, starting with this right side. She's going to keep this protracted position, and she's just going to let her arms slide up the wall, really pushing into the wall the whole time, and then come back down. And we're gonna try next time to keep the elbow against the wall the whole time. So pushing into the wall, push as hard as you can into the wall, really push, 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 push. There we go. So now we've got some really good upward rotation of that scap. We're still very protracted, so that serratus anterior is very short, and then coming back down.
所以我们需要客户保持积极的顶住墙面，然后我们可以从单侧训练开始，主动的推墙的同时，然后慢慢将手臂向上滑。做到一个肩胛骨的上回旋。
All right, and I'm back in. And we want to keep it neutral, so she's drifting a little bit out to the outside. I just want her going straight up and down right now. There we go. Good. And so you're just making sure that your client maintains this tension, and they're going to get stressed. Like they're going to start to feel this into like underneath the shoulder blades. They're going to feel this into maybe even the front of the shoulder because the serratus anterior wraps around. And you just want to make sure that they're getting into that protracted position low, and then they're pushing up. And as they get higher, they'll start to feel it's more serratus anterior as they get above because the pec major and minor aren't able to be worked into that protracted position anymore.
好，所以在它保持前引慢慢向上的同时，它会一点点感受到它的肩关节的前侧，包括后侧，包括肋骨的外侧都会有一些酸胀感，这就是它的前锯肌在慢慢的去发力。那这个状态在前引状态再做上回旋，这个时候它的这个胸小跟胸大就没法去代偿，所以这是非常好的一个针对前锯肌的训练。
So when we're looking now to integrate those two, so we did our lower trapezius on the floor, we did our serratus anterior here. Well, they can work together in positions overhead. And so what I'm going to do is I'm now going to get her to do the same thing, protracting away. So still serratus anterior activation. We're going to do this left arm because I'm on this side. So she's going to actually externally rotate a little bit. And now she's going to press up and out. She's going to allow the elbow to come off the wall as she reaches up and out. And once she gets to full extension of that elbow, she's then going to pull that arm off the wall with that lower trapezius and then bring it back to the wall and then come back down again. So we're getting both serratus anterior and that lower trap working together in this movement.
我们通过一个动作把刚刚的中下斜方跟前锯肌组合起来。首先在前引状态，我们主动做一个外旋到刚刚跟它这个中下斜方力线相同的位置。然后我们会主动的做一个伸肘，这个时候允许你的肘关节离开墙面，也会变成用手支撑的一个直立状态。在他的手肘完全伸展之后，我们会靠中下斜方发力，让他的手离开墙面，所以会跟刚刚我们地面的歪会很像的一个动作。然后再次还原，让手回到墙面，屈肘，肘关节形成支撑，慢慢在前引状态回到起始位，所以可以组合练到中下斜方和前锯肌。
Now from here, as we've kind of looked at balancing those force couples, we're going to then look at, okay, how do I add maybe some reactive stability? Because we've now moved from posture and the thoracic spine into the scapular position. And we've started to work on the force couples to even it out and position that scapula more efficiently. But now, how do I add some reactive stability and motor control to the actual glenohumeral joint, so the rotator cuff itself? And this is where having maybe positional isometrics with some perturbations will be very beneficial, but also utilizing a kettlebell as a way to get some additional reactive stability. So I'm just going to show you a couple things you can do just with a kettlebell to get some reactive stability into that shoulder. And then we'll just finish it all up by reintegrating it into actual shoulder movements itself. So right here, I've got a relatively light kettlebell. It's only 12 kilos. Sorry, I'll let you translate that. My bad.
Okay. 所以刚刚我们经过了这个姿势的评估啊，动作的评估，加上一些这个体态的筛查，再加上我们刚刚调整力有关系。这一系列的训练都是为了让肩胛骨可以在更好的位置上。那当我们肩胛骨回到更好位置上之后，我们希望它有一些主动的或者说反应的稳定性的能力。接下来会尝试用壶铃做一些类似的训练，啊，提高一些它整个肩袖啊以及肩关节运动的这样的主动能力。
Now, a 12 kilo kettlebell is pretty light, but I'd probably use this purple band, which is only about 1.5 inches. If I'm going any heavier than 12 kilos, I'm going to want to use a green band, but this will also depend on how tall you are. So I'm pretty tall. I'm about 6'2", so 6'2". So I'm going to use a bit of a thicker band because I don't want it bouncing off the ground. And so I'm going to wrap this band around twice. And then I'm going to just hold this up. And what I'm going to do is I'm just going to walk. And as I walk, this kettlebell is bouncing up and down as I walk. And so it's actually causing that the rotator cuff to reactively stabilize that glenohumeral joint, while also giving me a little bit of a distraction as well as it pulls that shoulder and relaxes some of the muscles in and around that shoulder.
好，所以这个训练大家可以看到，我们的准备动作啊，可以用一个弹力带。比如说，如果你觉得这个弹力不够大，你可以相对来说用更宽一些弹力带套在一个壶铃上，壶铃重量也可以进行调整。那我们需要做的是把它绑好之后呢，拎在手上，一边走一边感受到它向下的一个拉力。那壶铃这个重量呢，它上下的震动会给到我们肩袖的一个刺激，就是肩袖需要时刻去反应有多大的力，再把肱骨头从关节窝里拉向外侧，所以它会时刻去对抗。那同时，这个拉力还会给到你整个肩部肌肉一些拉伸的感觉，一些放松的这个感受。
Now you can do this unilaterally, so you can do it just with a single arm. You can do it bilaterally with both arms, depending on what your goal is. If you do it unilaterally, you add some core stability into it or abdominal stability as well, which would be really probably beneficial for that client as well. But it's really up to you about what you want to get out of it.
所以这个动作你可以做单侧，也可以做双侧，取决于你的训练目标。如果你想要多一些核心的控制，一些核心的稳定，你可以做单侧。
And then from there, I really like to integrate bell up carries. So where I actually have the kettlebell and I'm doing a carry, but now I have the bell up. So it forces me to create a lot of not only wrist and forearm stability, but also that shoulder is having to stabilize in that position as well.
好，从刚刚这个动作，我们可以进阶到一个壶铃反向农夫走。大家可能平时经常拎着壶铃走，那非常推荐一个动作，就是把壶铃倒置抓在手上。不光是手腕、手肘的稳定，更多是我们肩关节会使肩袖去维持这个关节的稳定性。
Now for this, you can try different elbow positions. So I like to start lower, so the elbow just off the body in this position, and then I work my way up to about 90 degrees. So now I'm 90 and 90, and then you can progress this to overhead. I hope I don't hit the ceiling here. So then you can progress this to overhead as well, and you can have them walking as they do this. And I'm starting here in a neutral position, so right in front, but you can also bring it out to about 45 degrees or so out to the side and do the exact same thing.
好，所以首先从侧面看，壶铃的高度可以调整。第一种选择呢是手肘更靠近你的身体，然后我们可以慢慢向上推到你的肩区、肘区都是90度，也可以向上推到过顶位。 在任何位置都可以加上行进去增加挑战。你也可以从正面看，不仅是在时装面上做一个区，而是向外打开一点，做一点主动的外展，在45度的状态下继续做不同位置的支撑。
All right. And then once we've done that and we've gained some stability, we're going to want to reintegrate it back into movement. And this is where I really like really open kinetic chain exercises without a lot of stability being provided to the scapula. So oftentimes we go straight from all of this really good, healthy rehabilitation in open or closed kinetic chain, and we put them onto a bench. We start doing dumbbell chest presses and bench presses, thinking that that's movement. But I just want you to think about this, and then we'll kind of close off this session, is how often does your client actually push with their scap stabilized to a bench? Other than in the gym, very, very rarely. Most of the time, they're pushing without that scap stabilized or pinned, so it has to create its own stability. So allow your client to explore those types of movements, whether it be a kettlebell press over top of the head, a cable press into the front, so a horizontal push, or perhaps it's even just push-ups, and that's where you kind of start them. But allow that scap to get the movement that it needs, and that takes some stress off of that glenohumeral joint and allows that system to do what it's actually going to do in real life.
那么下一步的进阶啊，其实非常建议各位让大家去探索，让你的客户去探索一些开练运动，也就是让我们的肩胛骨没有太多的支撑。比如说我们非常喜欢的卧推动，把肩胛骨拼命的回缩，锁在凳子上去做这个训练。那客户日常生活中又有多少动作是这样完成的呢？几乎没有。所以我们希望更多的是可以去做一些向上的推举，一些绳索的前推啊，一些甚至是最简单的这个俯卧撑，它也是允许你肩胛骨有更多的运动幅度。当你肩胛骨能够完成更多的运动的时候，这时候其实减少了你肩关节的压力，让他们去探索一个最佳的发力机制。这个时候或许是更具备功能性。
It's important to remember that every single client you see will be a little bit different in what they need, how they present to you with all of your assessments, and how they respond to some of the exercises that we've shown. But there are a lot of different exercises. We showed you only 3, and that's a progressive sequence for a couple of the force couples. We showed you a little bit of reactive stability. And then reintegrating the shoulder back into movement is actually relatively easy. You use just lighter loads and you move them along, and you're using progressive overload, which is what you probably learned when you became a trainer. But you have to be very, very careful when working with somebody who has had pain and dysfunction that you reintegrate properly so that you don't overload them and then cause them to regress back.
所以我们今天给大家提供的其实是一个训练的思路啊，从最开始的评估到我们希望可以调整一些立偶的状态，调整一些关节的位置，再到我们积极主动的练习一些反应稳定性，再到整合到最终的这个训练。所以实际上到最后一步呢，应该是比较简单的。大家学过非常多的负重训练，就是去调整这个肩关节的力学。在前面基础打牢之后，我们可以用一些很轻的重量来让它重建动作模式。但尤其要注意的是，每个客户都会有不同的差异，你可能观察到不同的信息、不同的状态。这个时候，动作的选择也需要更多的去思考。尤其这个客户如果已经出现了一些疼痛，那你在与他配合的时候，需要更加的注意一些。
So we only had 2 hours for this session, but really this topic could probably be a 3-day course for some people to really dive deep into the anatomy and understand what's going on, how to do some of the manual therapy for themselves, and then how to work on evening out those force couples and balancing and reintegrating everything back into activity. But I hope that within this 2-hour session, you actually gained some really good information about things that you can do either for yourself to optimize your shoulder presses or overhead movement, and especially for your clients as well, who may have difficulty in those positions or have pain in the shoulder.
今天虽然只是一个2小时的课程，但大家会发现每一个点都可以充分的展开，有可能这个课完整的版本3天都学不完，但实际上我们希望给到大家一些新的思路，无论是评估的思路还是训练的思路，可以帮助到你自己和你的客户，让你获得更好的肩胛以及肩关节的健康。
So I just wanted to thank all of you for taking the time to listen to me ramble on about the shoulder and scapular dysfunction. As I said, I hope you really pulled a couple things out of this session. And I just want to applaud each and every one of you for just demonstrating a dedication to learning and a dedication to your clients and wanting them to be better.
所以最后非常感谢各位同学听了2个小时关于这个肩胛、关于肩关节一些相关的训练。那么也非常感谢各位对于自己专业的投入和对于客户更好服务的一个投入，非常感谢各位的时间。
I also want to thank Lee for putting all of this together and Arthur for just interpreting for us. I know this has been a lot of work and you guys are probably really, really tired as I am from actually presenting all of these. But I just want to thank all of you for just making this possible. And I look forward to seeing all of you in IDEA China, next year.
感谢所有的配合人员啊，让这个 IDEA 大会可以实现。那我自己讲课都会感觉到一些疲惫，那相信对你们来说也会是非常大的工作量。非常期待明年能够在 IDEA China 的现场见到各位，再去探讨我们相关的训练话题。
If you have any questions about this session or anything else regarding training, rehabilitation, strength and conditioning, please feel free to reach out at me. All of my information is on the screen. So my email is just adam@kineticperformance.ca. You can check out our website where you can find a podcast and some other materials as well. And you can also follow me on social media. So whether it be on Twitter, on Facebook, or on Instagram, you can find us at KineticPRFM or by simply just searching Kinetic Performance.
好，那大家如果关于训练、关于康复、关于任何有问题想要联系到我，那这个课件上可以看到我的联系方式。对，非常欢迎各位可以给我写邮件啊，在官网上留言，在社交媒体上来持续关注我的动态。
Thank you.
感谢各位。Thank you, Adam.
Thank you.